Well, tonight we want to answer some of the questions we know you have about this coronavirus outbreak.
So we turn to Dr. Dan Field. He has 30 years of experience in emergency medicine, and he's the chief medical officer of MD Staffers. We brought him some of the most common questions that you have posted for us or sent in.
Look for the same kinds of symptoms with a cold or your basic flu, and that would be upper respiratory first, sniffles, a sore throat, scratchy feeling, and then coughing, fever, followed by body ache and fatigue. The shortness of breath and chest pain, if things go worse for you, those come a little bit later than those other symptoms. If the coronavirus acts like previous coronaviruses, there should be immunity and people should not fear getting a reinfection. It's possible that they will continue to shed virus after their illness resolves, but that's not the same as being infectious, and that's not the same as being infected again. I intend to myself go out, do walks, do runs. This is something that you do not in proximity with other people, so that's okay. You're easily making the 6-foot social distance with those kind of activities. The children themselves are not at risk for a serious illness. That's not going to be the problem. But children are vectors. They carry disease, and they will carry this back to the home and infect the parents, and then it'll spread from there. So that's really what the fear of children is, and but it's not the fear for the children. Anybody with cancer is considered high risk. That's a broad term. Somebody who has had recent chemotherapy, I think, would be obviously much more at risk than, say, a stage 1 cancer survivor who beat their cancer 5 years ago and has been well ever since. They don't distinguish between those two. They just make a broad stroke and say, if you're a cancer survivor, if you have cancer, then you're at risk. But I could make those distinctions myself.